Hello everyone. Next, we will learn about orthopedic disease in hip joint. First, we will begin to learn the anatomy of the hip joint. The hip joint is the largest and most typical in arthrosis, with the deepest glenoid fossa in human body. And it is mainly composed of acetabulum and femoral head. The acetabulum is surrounded by a tough glenoid labrum, which not only increases the depth of glenoid fossa, but also tightly wrap the femoral head. Its main function is to bear weight and move in multiple directions, absorb and relieve shocks, and play a leverage role in the body activities. First of all, the top of acetabulum is formed by body of ilium. The posterior wall and bottom of acetabulum is formed by body of ischium. The anterior wall of acetabulum is formed by pubic bone, and these three parts together form the acetabulum. The anterior part of acetabulum is low. The posterior part is raised. The lower part has deep and wide gap. The transverse ligament passes through and seals the gap, forming a hemispherical fovea. And it is surrounded by a glenoid labrum margin formed by cartilage tissue, which increases the depth of acetabulum and makes its area exceed half of the spherical fovea. The top part of acetabulum is the main weight-bearing area, which can enhance the stability of joint. The articular surface is half moon-shaped, covered by hyaline cartilage, and the bottom part extends to the acetabulum notch as an acetabulum fossa, which is occupied by femoral head ligament. Then the femoral head, which is circular, and its upper part is mainly covered by articular cartilage, and its edge forms glenoid labrum. And there is a small fossa behind its top, which is the attachment of femoral head ligament. The femoral neck is slightly forward, and its middle part is thin. There is greater trochanter on the lateral side and a lesser trochanter on the medial side, which is the attachment of multiple groups of muscles. While the femoral calcar is in the medial and posterior of the femoral shaft and neck junction, which is a longitudinal bone plate composed of multiple layers of compact bones. The femur is weight-bearing and eccentric, and the femoral calcar is its point of strength. Then we look at the hip articular capsule, which is attached proximally to the acetabular margin and the transverse acetabular ligament, and is composed of shallow longitudinal fibers and deep transverse fibers. The lateral side of articular capsule is strengthened by ligament and the medial side is joint synovium, which has functions of supporting heat dissipation and reducing friction. The synovial cells also have the function of semi-permeable membrane, which is the exchange place of various chemical substances. The synovial fluid is present in the articular cavity and is the nutrient solution for articular cartilage and the lubricating fluid for joint movement. Finally, articular cartilage. In the synovial joints, the junction of bone is covered with a layer of transparent cartilage with the thickness of 1 to 5 millimeters, which is an isolated tissue without bone vessels, nerves, and lymph vessels after maturity. The central part of spherical articular surface cartilage of femoral head is the thickest, and the acetabular cartilage is also relatively thick. The articular cartilage plays a major role in load transfer and can reduce friction and consumption during motion, and its elasticity plays a role in shock absorption. Finally, we will learn the special examination methods of hip joint, which mainly include the following.
Pelvic separation and compression test. Compression test of pelvis. The patient is in supine position. The examiner squeezes the pelvis towards the midline with both hands on either side of elarm, or the patient lies on the side. The examiner squeezes the crista iliaca above it. In case of pain on affected part, that's a positive compression test of pelvis. Pelvic separation test. The patient is in supine position. The examiner puts both hands in front of the anterior superior iliac spine on both sides respectively. Push both hands posteriorly and inferiorly at the same time. In case of pain, that's a positive separation test of pelvic. Patrick's test. The patient in supine position. Flex the knee of the lower extremity on the side being examined. Keep hip joint flexion, abduction, and lateral rotation. Put the foot on the other knee. Make a full shape for both lower extremities. The examiner puts one hand on the medial side of the flexed knee joint. Put the other hand in front of the anterior superior iliac spine on the opposite side. They press down with both hands. In case of pain at the sacroiliac joint on the side being examined, the test is positive. Indicate sacroiliac joint lesions. Besides test, the patient is in supine position and close to besides. The body cords protrude slightly. The thighs hang down. Flex the knee and hip of the lower extremity on the heel side. Make them close to abdominal wall. The patient holds his knee with both hands to face lumbar vertebra. The adult holds the iliac spine with one hand to face the pelvis. Place the thighs beside the bed with other hand. Extend the hip joint as far back as possible. If case of pain in the sacroiliac joints, it is positive sign. Indicate sacroiliac joint lesions. Half extension test. patient is in supine position. The examiner places the lumbar sacral region on the affected side with one hand. Hold the ankle on the affected side with one hand and flex the knee on the affected side by 90 degrees and straighten and lift it upwards. Hyperextend the hip joint. Twist the sacroiliac joint. In case of pain, the test is positive. Indicate lesions of hip or sacroiliac joints.
According to the special examination, we have a preliminary diagnosis of hip injury, and then we need to select imaging examination to confirm the diagnosis. Well, class is over. Please review what we learned today after class. Thank you.